Okay. Well, good morning, everyone. Thank you for joining us today. Hopefully everyone's getting ready for the holidays and the new year that's quickly approaching. The St. Joseph Community Health Foundation and Healthier Moms and Babies co-facilitate this quarterly meeting for anyone in the community interested in providing quality prenatal and infant care services in Northeast Indiana. These quarterly meetings focus on strengthening skills and knowledge of prenatal care providers, providing introductions to others engaged in the work in the community for easier referral and coordinated resources, offering professionals education on new trends, research on the best practices in prenatal and infant health, and sharing updates on local programming opportunities regarding prenatal and infant services. Pre-pandemic, these were lunch meetings so that people could interact in person and network, and hopefully we'll be able to get back to that in-person meeting space soon. But for now, virtual meetings like this one work great too. My name is Angela Stanley, and I am the Vulnerable Populations Program Officer here at the Foundation. My work largely focuses on 3 of our 4 impact areas: prenatal and infant care, access to quality, affordable health care, and immigrants and refugees, and helping vulnerable and marginalized populations gain access to resources. My colleague, Mary Tyndall, is here with us, and she'll be keeping track of any questions you have during this presentation. And Mary, it'd be great if you could introduce yourself.
Sure. Thanks, Angela. Hi, everyone. Happy Friday. I am Mary Tyndall. I am the Food and Nutrition Program Officer here at the St. Joe Foundation, and I work on our Double Up SNAP matching program, as well as work with our grantees who work in the area of food insecurity and nutrition. Thank you.
Thanks. So you're going to be hearing from both of us during this presentation, me speaking with our panelists and Mary popping in with all of your questions. So as we get started, it'd be great if you could introduce yourselves in the chat with your name, your agency, and any work your organization has done or wants to do to address COVID vaccinations. And also, if you have any announcements from your agency or anything you'd like for us to include in our upcoming newsletter, please feel free to put those in the chat as well, and Mary will catch those. And then lastly, if you have any questions for the panelists, please put those in the chat. Mary will make sure they get asked and answered during the course of today's conversation. And just a few pieces of housekeeping. Please mute yourselves. And I know everyone has a little bit of Zoom fatigue, and we're all tired of staring at ourselves in little Brady Bunch boxes for the last 2 years. But if you could turn your cameras on, that really makes the conversation more interactive for the speakers, as well as everyone else listening. So let's meet our speakers. Today, we have 2 local physicians who will share the latest information about COVID-19 vaccines. They'll cover the safety and efficacy of vaccines in pregnant women, women of childbearing age, and children. And it's important to note that today they'll be speaking based on their own experiences and to the best of their knowledge, but always look to the accepted organizations and guidelines for the latest information that's always changing. The information they provide, though, will help care providers and those within the prenatal and infant care network more precisely discuss with their clients the opportunities and concerns associated with COVID-19 vaccines. And both of these physicians also serve on the Medical Advisory Board of Healthier Moms and Babies. So Dr. Lucia Fouts is a board-certified OBGYN and earned her medical degree from Indiana University School of Medicine. After completing her OBGYN residency at the University of Louisville in Kentucky, she joined Women's Health Advantage in 2003. She's an OB chair for the DuPont Hospital and has been an assistant clinical professor of OBGYN at the Indiana University School of Medicine in Fort Wayne campus, and is now a member of the laborist programs at DuPont and Lutheran hospitals. And Dr. Eric Shoemaker is a duly board certified family medicine doctor who received his medical degree from the University of Pikeville, Kentucky, College of Osteopathic Medicine, completed his residency at Fort Wayne Medical Education Program, and has been in practice for 2 years with Parkview Health. I really want to thank you both for taking time to have this conversation with us this morning. So to start things off, I wonder if you could give an update on the status of COVID here in Fort Wayne or Allen County. We've been hearing a lot about Allen County being in the red again. So can you give us a snapshot of what's going on right now regarding COVID numbers, vaccination rates, trends you're seeing among your patients or within the medical community, and anything that's relevant to the work that each of you do. And Dr. Shoemaker, if you want to.
Go first if you want me to. So
yeah,
number-wise, we are certainly up. We had a PIC provider-wide meeting last night, actually, and numbers in the hospitals are quite high. We are approaching higher numbers than we've actually ever had inpatient-wise during the entire pandemic at Parkview and surrounding Parkview hospitals right now. So pretty significant rise in COVID as of late. Anecdotally, I've seen a lot more in my clinic over the last 2.5 weeks than I would say I've seen in the entire pandemic. And then on top of that, we are currently red in Allen County. Basically half, the northern half of the state is in red. And then Indiana is one of the top 6 states in the country with the highest COVID rate right now. So it's pretty significant in Indiana. Trying to get people vaccinated. We're working diligently on getting 5 through 11-year-olds now vaccinated within the health system in our offices and at Super Shots, and then adults at the remainder of the facilities around the community. So we're just doing the best we can, but vaccination rates could be higher. Nationally, we are lower in Indiana than the average. But we continue to get more and more every day. And so that's just a goal we need to continue to work towards.
thanks.
And I would add to that, this needs to come out in the data. At some point, we just need to have enough history with it, but we're definitely seeing an increased risk of delivery complications. So pregnancy is a trifecta of immunocompromised, decreased pulmonary function, and coagulopathy, something that COVID seems to nail all of those things very easily. And so we're seeing increased issues with morbidity and mortality around the time of delivery, difficulty with placentation, with placentas being delivered easily. There's good data about this in many places that you can find about increased risk of accreta, preeclampsia, clotting disorders around the time of delivery, and increased risk of maternal death, which, depending upon the studies you can find, seems to be about a 30 to 40% increase in maternal death compared to previous. I suspect that it's higher than that. And I mentioned in the last webinar we did, in the last 18 years that I've worked in Fort Wayne, I've seen or heard of 2 maternal deaths in 18 years. In this past year, we've had 3, and probably 1 on the way, which is a terrifying increase in a situation that we normally think of as a very safe and hopefully happy process.
Yeah. And that's something that I wanted to kind of tease out a little bit, because even though we've been living through this pandemic for, well, it feels very crazy to say years now, but years through this pandemic, but there's still a lot of confusion for a lot of different reasons that are probably too numerous to get into right now. But obviously some of those concerns have to do with the impact of COVID on pregnant women. So you talked some about the impact of COVID, but I don't know, do you think that people are getting the message that, there is an impact on symptomatic COVID on pregnant women and what it could possibly be doing with their babies? And you mentioned kind of some of the outcomes that are happening during delivery. So can we talk a little bit more about the risks to pregnant women with symptomatic COVID and the risks to their unborn and newborn babies?
Well, the risk to the babies seems to be overall relatively low. The risk of preterm delivery is definitely higher. Most of the moms that we've had to deliver early in order to increase their pulmonary function and to, frankly, help them survive or try to help them survive, have ended up delivering severely premature. And so the risk to the babies are probably more of the risk of prematurity than anything else. That's pre-delivery. The risk to the moms are significantly greater, mostly all of those risks of clotting disorders, pulmonary dysfunction, having to go in heart-lung support, just because they're so compromised. I think that it's going to take a while for that to become general knowledge. I think that there's a lot of misinformation, disinformation rampant on the internet right now. And I think that like a lot of other social transitions, you know, people worry about, if I get vaccinated and I go home, is my family going to scoff at me? Are they going to scorn me? Are they going to start saying, well, you did that to your baby? I think there's a lot of worry about that, more so than the worry about, am I actually going to cause myself harm by not getting vaccinated?
Dr. Fouts, we have a question in the chat that I think is related to what you're talking about. And someone is wondering if these women who you're referring to are having complications, if they've been vaccinated, or are they unvaccinated and COVID positive?
Thank you. No, indeed, I'm talking about unvaccinated women.
Thank you.
We are not seeing the same complications with vaccinated women. The protection that the general population gets seems to hold true for pregnancy. They have a lesser course of disease. They have less chance of death around the time of delivery. They have less chance of hysterectomy around the time of delivery, adverse bleeding events, clotting disorders. All the things we worry about with COVID seem to be remarkably less.
And Dr. Shoemaker, as a family medicine doctor, do you have those conversations? Do you see people coming in with concerns about pregnancy or hesitancy about getting vaccinated?
Yeah, definitely not so much hesitancy about getting pregnant during the pandemic, but hesitancy about getting vaccinated during pregnancy.
Mm-hmm.
Absolutely, we have those conversations daily. In fact, I'm working at the neighborhood health clinic right now, supervising the family medicine residents, and here we do all of the prenatal care. And so this is a conversation we've had multiple times today about getting people vaccinated during pregnancy, and that's just like anything in medicine, there's risks. There's risk with the multivitamins we take every day, but the benefit far outweighs the risk in getting vaccinated in pregnancy, because you're protecting mom, you're protecting baby. Just like Dr. Fouts was saying, you're reducing risk of prematurity. And prematurity is nothing to be messed around with. That has lifelong implications on the baby. And so when you're getting vaccinated, you're not just getting vaccinated for you, you're getting vaccinated for your unborn child too.
Yeah. So let's talk vaccinations. We keep hearing from all kinds of reputable people and organizations that it's one of the best ways to protect yourself and others to get vaccinated. But again, there's still a lot of confusion and hesitancy among folks. So just kind of plainly, is it safe for pregnant women to get vaccinated?
Definitely. It seems just as safe as any other vaccine we've used. I think that sadly, it's going to take some time to get traction and common knowledge about it. But I think that there's also some provider fatigue that goes on. You know, I diligently, and I hound the residents at the clinic too, you know, you have to talk about this. It's our obligation to protect women from coronavirus. In fact, there's an ethics paper that ACOG, American College of Obstetrics and Gynecology, put out in July, saying that it's an obstetrician's ethical obligation to talk about vaccination to protect the pregnant woman. But I think when your patient is staring you in the face and looking daggers at you, and you realize that there's other stuff going on, it gets fatiguing after a while. But definitely it seems to be, you know, safe in pregnancy. The original Johnson, or sorry, not Johnson & Johnson, I misspoke. I only know about Pfizer and Moderna studies. The very original ones did have pregnant women in the studies. They weren't intentionally about pregnant women, but those women were in the studies, and they were followed long-term. Those babies were followed long-term. They seem to have done well. There have been intentional studies with pregnant women and vaccination since then. And those babies seem to have done well, better than non-vaccinated women. we do believe that there is the same kind of protection that babies can get off of Tdap shots and flu shots and all the other vaccinations that we can use in pregnancy, that seems to be true of coronavirus vaccinations as well.
So do you know what the rates of vaccination are among pregnant women?
So I did a lit search on this last night just to see if I could find a current number.
Yeah.
It's everywhere, but sadly, no, I wasn't able to find anything greater than about 30%. So I think it depends upon the part of the country. There's well-documented studies going at it from a number of different angles that if it's an underserved or of color population, there tends to be a lower vaccination rate than other populations. Education seems to matter. Socioeconomic status seems to matter. Those things are true of lots of different access to healthcare, but definitely true of vaccination as well. But 30% seems to be the best that I can find anywhere. I'd say in my clinic, that's about what I've got. And that's with me hounding my pregnant patients about every other visit that they need to get vaccinated.
So if we're talking about, you mentioned earlier that many of the complications are among women who are unvaccinated. So can we just talk a little bit more about why it's important for pregnant women to get vaccinated, what the benefits are for the maternal benefits for vaccination, and what the fetal benefits are for getting vaccinated against COVID?
Well, the maternal benefits, the biggest risk is death. We reduce the risk of maternal morbidity and mortality, but most significantly mortality, by vaccinating. A woman's chance of dying in childbirth in general in the United States, as of about 10 years ago, is about 1 in 9,000. In a hospital setting, that was a great deal less. In a home setting, that was a great deal more. The risk of dying in childbirth right now, regardless of setting, is about 30 to 50% higher than it has been historically. And again, some people would say 1 in 9,000 is not that big a number. That's not as big as the risk you might take in your lifetime of dying in an auto accident, which is about 1 in 200. But it used to be that women died in childbirth all the time, and now they don't. It's, childbirth has turned into a relatively happy, most of the time, not terrifying situation. And it's a hard thing for a new father to take a baby home without another parent there to be with them.
So how do you both deal with the fatigue around talking to people about vaccinations, trying to get them vaccinated, getting the pushback? So it's important to both of you. So how do you keep moving forward with this messaging?
It's definitely a challenge, and it gets harder every day. Never would I have thought. So a little backstory. In medical school, when I graduated med school in 2016, we had joked like, okay, about every 100 years there's a pandemic. I regret joking about that now because it was the Spanish flu in the around 1919. And we thought, okay, anytime there's going to be another one, not truly thinking there would be one. But now here we are. And so I guess some little spot in my brain knew when I became a physician, and I'm sure it's exactly the same with Dr. Fouts, is that you commit and you know that there are going to be plenty of hard conversations in your career. And they're not just going to be during the first 2 years of your career, the last year, they're continuously throughout your career. And so I think being a physician, we know that those conversations are always going to happen. And we're kind of mentally in that zone that it's our job, it's our responsibility have those conversations. It doesn't make it any easier per se, but If I can change one person's mind, or if I can change one person's life, whatever the case may be, that's a success. And so if I can convince one person to get the vaccine, great, that's a success. And so my job is to bring them unbiased, truthful information that is really hard to come by now. And that's how I see my role in this pandemic, is that I'm not here to be political. I'm not here to give, biased opinions. I want to give you the facts. And so that's my conversation. And I give conversations rooted in facts the best I can. And it makes those conversations easier to have. Because I can say, this is what I've seen. This is what I've seen in my own practice. And you just every day is a new day. And you take a deep breath, you center yourself and start another conversation. And sometimes you have to center yourself multiple times a day. Sometimes it's before stepping in that room the next time, multiple patients in a row. But you got to do what you got to do.
I totally agree. I think this is a brick by brick thing, you know. Some days I'm exhausted, and so I wear my vaccine t-shirts and I can't talk about it. I'm giving myself a break, but I'm still saying the message that I believe. And I think that Eric spoke about this, I think last time a little bit. You know, we have to kind of speak from our hearts. We have to, a lot of this misinformation is getting traction because the people who are presenting it are saying that they care about people's health, or they're working on fear, which is, you know, probably the vast majority of it. But I think that with our patients, the more we can bond, the more we can say, you know, I care about you, but I also do care about factual data. I'm not interested in drama. I'm not interested in working on your fear in a manipulative way. But I want you and your baby to be safe. And this is what I've seen. You know, I think that that matters to people. Every once in a while, I'll have somebody come back and say, okay, tell me that again, you know, and fortunately with pregnancy, you see people multiple times in a year, you know, 10, 12, sometimes more than that times in a year. You have a chance to push your message in a way that other providers don't have. And I think as long as we do it with kindness and empathy, we have a better chance of getting the message across.
Yeah. And I think you mentioned earlier that this particular vaccine isn't necessarily a whole lot different from other vaccines and medications that folks have been taking for years. Can you talk a little bit about this? Is this something that's drastically different from other vaccines we've seen before? And what makes this one so different for people?
So no, this isn't drastically different. Back in the early 2000s, when we had swine flu and all the other SARS, they were much more advertised as SARS. Those flus, scientists started working on developing mRNA vaccines. We've been using mRNA in cancer treatment for over a decade. And so rather than having it in an IV or having it in a syringe, it's not a whole lot different in principle. It may feel different, but it's not a whole lot different in principle. And so no, it's not true. It's new, but not brand new. The data is there, the philosophy is there, the science is there, the understanding is there. That's not new. And the beauty of science and the beauty of where we are in medicine nowadays is that we have the ability to react quickly. Back during smallpox, that took time. That was not as studied as this vaccine was, but people trusted it blindly. But now we're able to react and understand and evaluate so much better than we were there. And so in these moments, we're ready to respond fast. It took a long time to create the vaccine, but in the grand scheme of medicine, that was fast. But that doesn't mean it was poorly studied, poorly understood. These are things we've been working on for a long time. That's the beauty of science nowadays, is that we have this ability. We're good enough to do this.
One thing we talked about before too, I think that's important is living memory, the population we deal with tends to be younger. They don't have living memory of people who had polio. They don't have living memory of people who experienced a baby with fetal rubella syndrome. And I think that the population right now that's pregnant or is going to be in the pregnancy age range, they're used to social media, they're used to the internet, they're used to information sources that wouldn't always have been available in the past when vaccines were touted as the thing that eradicated disease. So I think it takes a little compassion for, the amount of physical data, true or otherwise, that people are getting. They don't have living memory of. I had an elementary school friend who had polio. She was destined to live a life with crutches, a brace, and a funny smell. In the clinic, in neighborhood health clinic, we've had a patient who had a child die of polio, shortly after they immigrated to this country, because they came from a country that didn't have universal polio vaccination. We're not used to thinking about these diseases that have been eradicated, but there was a time when they were the terror of every mother's life.
And early in the conversation, you talked about, the push being now to get children vaccinated, and, there are still concerns around that. So is it safe for children to get vaccinated against COVID?
I'd say absolutely, without a doubt. Just from the timing wise, from when it was released for adults to now, now being the 5 to 11-year-olds, that's a lot of time. That's a lot of time for studying to happen. We know that with vaccines, the negative side effects are seen within the first 2 weeks to 2 months after that vaccine, and we're well past that 2-month period. And truthfully, our bodies are a lot different from the kids' bodies, adults versus kids. Obviously, there's obvious differences, but our immunity doesn't change. How our immune system works doesn't change. So absolutely, they're safe. Absolutely, they're safe. And over 6 billion doses of a COVID vaccine have been given out across the world. And if we would know now if it wasn't safe. 6 billion doses. That is an unfathomable amount of data. And so absolutely, it's safe for adults, it's safe for kids, it's safe.
Okay.
But the 5 to 11-year-olds, we don't have data less than 5 yet. And so we can't speak to that because, again, we're very data driven and we need to see that data first. It's great to assume that this will apply to everybody, but it's important to see that data. And that's the beauty of science.
It's also, I don't know if everybody's aware, but there's a program called VSafe that you can enroll yourself in after you've been vaccinated. You can participate in the data collection. I always, tell my patients, you sometimes have to watch it because there's a bias about that. People tend to complain more than they applaud. But, if you look at the VSafe data, people do tend to register their kids because they want to know if something's going on, and nothing unusual has shown up, and they've got quite a lot of data now through that program. It's an easy little app you can put on your phone. It sends me an alert. I've got 3 teenagers. It's the only time in the past 2 years I've been grateful that they were teenagers because I could get them vaccinated. And you can pull the app up on your phone, put in their data. It will remind you when it wants an update. How's your kid doing? Have they had any issues? And, it's trying to collect data aggressively along the way. There's a way to participate and be a part of it.
Yeah, that's great. And now a lot of the conversation has turned to the booster. Should vaccinated pregnant women get a booster shot? Should they wait? How do you know which booster to get? Can you just kind of talk about the boosters that are available?
Well, I think a lot of these questions need to be turned around. Can a pregnant woman afford not to get a booster? No, she can't afford not to get a booster. If anybody else can not afford to get a booster, then a pregnant woman needs to get it also, because a pregnant woman is more at risk. There's good precedents for boosters throughout history. We know that people's immunity wears off a little bit over time. We tend to notice that there's a new variant that comes out, about every 6 to 8 months or so, sometimes sooner. Boosters are a part of that, of combating that. So yes, pregnant women can't afford not to get a booster. Sorry for the double negative, but.
So I wanted to talk a little bit about vaccine hesitancy. So we've been discussing, there are still lots of questions and concerns about COVID, the various vaccinations, the boosters, misinformation, what we're seeing on social media, and it's all led to vaccine hesitancy. So I wanted to toss out a few questions that seem to be pretty common among people who are wary of getting vaccinated. So is breastfeeding safe after vaccination? How does vaccination impact breastfeeding?
It seems to impact it in a positive way.
How so?
Babies seem to have antibodies, and they seem to have some protection from breast milk that in a mom that has been vaccinated. So it seems to be helpful.
Okay. So it's completely safe for vaccinated women to still breastfeed.
Well, nothing we do is completely safe. As Eric said, you take vitamins, there might be a risk with that. We get in our car every day and we don't think about that at all. Walking down the street, you take a risk. So I would say there's no increased risk over there's no increased risk with the vaccine over not being vaccinated, although there may be protection.
Another question that kind of comes up pretty often is fertility issues. Does vaccination cause fertility issues? That's
a great one. I'm glad you brought it up. I've looked for the source on that. It seems to be, people, it's like that game of telephone we used to play when we were kids. We'd have a tin can and a string and another tin can, and you'd say something and the other person would hear something different, or they'd modify it slightly in their head. There's no reputable source about that. So no, the coronavirus vaccines do not seem to have any impact on fertility.
No evidence of that whatsoever. Anecdotally, I happened to see something come across my desk. It was either published in the Lancet or JAMA or one of those. It was more anecdotal evidence than statistically significant evidence, but it showed that men's fertility actually improved after the vaccine. Again, I'm not saying there's any statistical significance to that. And the authors pointed there's no statistical significance to that because it was a very limited study size, but numbers were improved anecdotally after the vaccine.
And another question that kind of comes up in these conversations, does vaccination cause miscarriages?
I think the data is still a little bit out on that. There is an increased risk of stillbirth, which is a different phenomenon. It's slight, but it does seem to be statistically significant and real. I don't think that there's enough data collected about miscarriage at this point.
Yeah.
But it would make sense that the rate would go up, just because the event of implantation is a very tenuous connection. It depends upon, not connecting too hard to the uterine wall. It also depends upon not connecting too lightly. And if you happen to have an infection that creates remarkable inflammation at the time of implantation, it would make sense to me that the miscarriage rate would go up. But I want the data. I haven't seen it yet.
Okay.
And I want to point out a comment that was just made by Erin Norton, and it's a phenomenal comment of 100% of women who die from COVID will not be able to have a baby in the future. That is a phenomenal point that we all need to keep in mind.
Yeah, I saw that come across. I was going to highlight that one too. So some of the concern for some people around the vaccination is how it was developed. What does it mean for vaccines to be developed from a fetal cell line?
So Eric might have a better explanation for this, but the fetal cell lines that vaccines may have been developed from were from around, my understanding is the 1950s or so. The current cells that they've, over years, those have been cultured, recultured. The best analogy I could come up with is, if you ever composted anything in your garden, you put a bunch of vegetables into a pile, you turn it over, eventually you get dirt. And that dirt is neutral. You can't figure out where it came from. It doesn't have any origination. It doesn't have any appearance of the previous cell line. To me, I think that's the cell lines they're working with right now. They're genetically neutral. They're blank. They're a blank slate, and reputable sources who work with them, and I'm not a molecular biologist, say that these are now no longer any appearance to what they originally came from and shouldn't be treated as that.
Agreed 100%. And there was one vaccine, if I'm not mistaken, and if I am, please correct me, and it was Johnson & Johnson that was made with the fetal cell line. The Moderna and the Pfizer were not. And so if there is an ethical, which is valid, I want to validate emotions and feelings and beliefs. That's one of my roles as a family doctor. And if anybody has a moral dilemma with that, I understand it, absolutely. But the Moderna and the Pfizer are still acceptable vaccines from that standpoint. And the whole conversation of cell lines, stem cell lines, you can get stem cells from numerous different places, experiences in the body, umbilical cord, amniotic fluid, different places. And so not all stem cells are embryonic stem cells.
So I'm just kind of curious, how can healthcare providers, agencies, people working in public health encourage pregnant women, new mothers to get vaccinated? This is a space that you've been working in for a long time. And I'm just wondering, what can you tell the rest of us who are trying to do this? How do we effectively communicate?
I think repetition, compassion, continually plug in our message, which is, understandably exhausting, but I think the goal is a good goal. I think that if we keep in mind, we're trying to diminish maternal mortality. We're trying to diminish prematurity. I think if we try to keep those things in mind and maybe not allow ourselves to become too exhausted, maybe we need to do more self-care. But I think if we keep our goals in mind and we keep plugging a compassionate, thoughtful, data-driven message, I think we will eventually, brick by brick, get a person every once in a while to listen. And maybe they'll influence somebody else. Not as fast as the virus is spreading, but it seems to be what we can do. Just because it's a hard goal doesn't mean that it isn't a worthy one.
I agree with all that. Compassion and personalization and those personal relationships are so important. Having the conversations, if you're a healthcare provider, saying, hey, I got vaccinated. This is what it was like. My daughter, my wife, my sister-in-law got vaccinated. She's pregnant, had a healthy baby. Just those stories and destigmatizing, taking the fear away from it. Because we're not doing this for fear. We're doing this for power, because we have the power to do this. And so just telling the stories. We're going through surrogacy right now, and I tell my patients, our surrogate has been vaccinated and has been boosted. And we are so happy and glad that she has done that. And I think adding that personal touch makes a difference, because we're not just people sitting in white coats. We take that white coat off and we go home to our families. and we have those regular people interactions.
Yeah.
And I have found, just to add to that, I have found that when I talk about the horror stories, people tune out. You know, they get so much of that, they can't bond with that. They can't, fear-based message, you know, while it's meaningful to me, while watching somebody who just had a 32-weeker be on ECMO is meaningful to me and terrifying to me, it isn't the right message for my patient. It doesn't get there.
Yeah. I know that both of you have been having these conversations a lot, and so I just want to make sure, is there anything that's important that you want this group of folks listening and after to know? Like, I want to make sure that, you know, I'm sure there are things that we haven't covered, but I just want to make sure that if there's something burning that you want to get out there to give you the space to be able to do that.
Something that I was going to say during our conversation that we had last week with healthier moms and babies was that give us compassion, give healthcare workers, anybody in this field, compassion and grace. It's tough. It's tough. Things are changing. Something I say today, we may learn down the road wasn't completely right. But that's the nature of science. That's the nature of medicine, as we're constantly learning, growing, expanding our knowledge. So give us grace during that, because science and medicine is not black and white. It's not cut and dry. It's ever evolving. But that's the beauty of the scientific method, is we learn, we grow. And so give us grace and understanding and compassion as things change during this pandemic.
I love that. I also, I would really advocate for starting conversations in the office. I made the mistake of assuming that since I knew stuff that my office staff did. And so I put out a message one day and said, hey, I'm not an authority, but I will find information for you. If you have a question, I'll try to find you a good answer. And, you know, we got 10 more people in our office vaccinated that way, because we started the conversation and we started handing out, you know, these were the questions I got and these were the answers, and I handed out the answers to everybody. But it was an error on my part that I assumed that they would look through the data the same way I would. And I think there's a lot of hesitancy about asking questions. People don't want to be stigmatized or have people talk about them. I think being willing to start the conversation sometimes can bring a lot of relief to that pent up distress we have every day with starting these conversations with people. So just start the conversation, say, hey, I just saw this study. Did you guys know about this? Or somebody had a question about this. It occurred to me that you guys might not know. Send it out, send it in an email. There are some people you're never going to change their minds, but there's a surprising number of people who are on the fence and just were waiting to hear something from somebody.
And Dr. Fouts, you had shared with us a map, and forgive us, we did not share that. Did you want to talk that through a little bit?
Oh, I think it was just a map of the current vaccination pattern in Indiana. It's in the Courier Journal. If you want to, I poached it off the Courier Journal. We're surrounded, what occurs to me looking at the map, the lighter you are, the less vaccinated you are. We're surrounded by a very non-vaccinated situation. So, you know, that's our job, is trying to make our northeast corner of the state look more like the middle of the state.
So we've got our work cut out for us. I just wanted to check and see if we have any final questions for Dr. Fouts or Dr. Shoemaker. Or if Mary, I haven't been looking, so maybe you saw
No,
some.
I don't see any in the chat. And
Okay.
just to remind people, if you want any messages in our next newsletter, our next PIC newsletter, to drop that information into the chat, and we'll try to put that in the newsletter as well. But I don't see any more questions. Anybody out there?
Well, I really appreciate this conversation. thank you all for joining us this morning, and thank you so much to Dr. Shoemaker and Dr. Fouts. Hopefully everyone found this conversation useful and can carry the information forward in the work that you do, and to remember to use compassion and have grace. As we approach the holidays, have a little more downtime, and we might be having that time spent with family and friends, and some of whom might not be vaccinated or they're hesitant. Perhaps we can use some of this information and some of these tips to talk to them. So again, I want to thank you all, enjoy the holidays, and we look forward to connecting with you all again in the new year.